So many of you were asking about the new format of the Anatomy Spotter exam. If you want to find out, stay tuned. Hello ladies and gentlemen, my name is Reza Rutsan. I'm the Director of Undergraduate Education at the School of Dentistry, University of Manchester, and thanks a lot for joining me on another episode of Manchester Molars. This week, Dr. Dixon and Dr. O'Connor run a lecture for the BDS AirFiber students to explain a little bit more in details of what to expect of their written as well as their clinical exams. If you did not have the chance to join the lecture online, Dr. Dixon has already placed all the slides on your blackboard, so by all means go ahead and have a look. But just in very brief summary, what you've got is your short answer paper in the online format, whereby you just log into your blackboard when the exam opens and you can go ahead and answer the questions, and it's very similar to the normal SAP which you normally have got. And if you want to know a little bit more about the clinical exam, again, by all means, please refer to Dr. Dixon's slides. At the moment, Dr. Dixon is very busy trying to produce an example of how these online interviews are going to run. So what we have done is we have invited a number of our own students who graduated from the BDS program last year to come back as pretend students, and we are going to have a number of our examiners running and recording these interviews. So what then you can do is you can go and watch how the sessions were run, what kind of questions they were asking, so you get a very good idea of what to expect of your exams when the time arrives. Now, if you're running out of ideas for dinner, how about I leave you with Emma to show you an excellent recipe for a coconut chickpea curry. Emma, they're all yours. So we received a number of queries from our BDS Year 2 students wondering what this new Anatomy Spotter exam is going to look like. So how about you join me on a video call to Dr. Dixon and Dr. Stefan Gabriel so they can explain to you exactly what to expect. Good afternoon, Carly. Good afternoon, Stefan. How are you both?
I'm very well, thanks. How are you, Reza?
I'm very well. Thank you very much for asking, Stefan. Stefan, could we start with you first? Because obviously our BDS Year 2 students never had the experience of this format of exam in this current new situation. Would you be kind enough to spend maybe a minute or two explaining how this new format of the Spotter anatomy exam is going to work?
Certainly. I think the first thing that we can sort of tell the students is that the exam is going to be an adaptation of what they've been used to from their first year spotter. So it's not going to be drastically different beyond the fact that we obviously have to do it online. Nonetheless, there will be a few changes. So I'll talk you through those in a minute. Okay, so firstly, it's going to be online. So it's going to be available through Blackboard. But when they go into Blackboard, they'll see exactly the same form as they would have seen on the iPads in the dissection room had we been doing the spotter in the conventional way. So the way you answer the questions or submit your answers is identical to the way you would do it normally. It's just that you're doing it on your own computer, your own tablet, possibly your own phone, in your own home, rather than on an iPad in the dissection room. Obviously, the second difference from the original exam is that it's an open book exam, and students are provided with 1 week to complete the exam. And so the exam will open at 12 noon on Wednesday, May the 6th, 2020, and it will close at 12 noon on Wednesday, May the 13th, 2020. We've explained that it's, unlike the original exam, it's a pass-only exam, but it is not weighted. But students still need to get 40% in this exam. There are several reasons for this. So firstly, students have to be able to demonstrate an appropriate level of anatomical knowledge for the anatomy that they're going to be using throughout their dental career. So we need to ensure that they have that level of knowledge. And as a consequence, if they get less than 40%, I would like to have a chat with them. I'm sure Dr. Sengupta would as well. But just to ensure this, and I think this is something we can talk about a little bit later as well, is that we are going to put some anatomical questions into semester tests in year 3 to cover that knowledge. Let us come back now to the spotter that you're going to be doing in May. So we are testing you on a slightly wider range of material than we did in the first year, and as a result we are testing you over 25 stations. So basically you will see 25 stations on the screen, so 25 screens, and each of those stations will have a 2D image from a textbook, or possibly several 2D images from a textbook, and each of those images is going to be labelled A to E. And each station is going to have 3 questions. So if you're happy with this, Reza, I think what would be a good thing now would be to show you some examples of the questions.
Please, Stefan, because that was my next request, just wondering if they can see some example ones. So by all means, please.
Okay, I will share the screen now. First thing I'm going to say is you will not see questions on this subject matter in your spotter. I've picked some examples from the abdomen to give you some example questions. We are not testing you on abdominal knowledge, and as a consequence it makes it good for an example. So firstly, you can see in the centre of the screen you've got a picture of the GI tract in the abdomen and associated structures, and you can see that we've got several structures labelled A, B, C, D and E, and hopefully you'll be able to see that A is the liver, B is the gallbladder, C is the stomach, D is the pancreas, and E is the descending colon. So imagine this is your station. You would have 3 questions, and those questions might be straightforward, identify structures. They might be functional questions, so identify the structure that does this, or they might be about the neurovascular supply or drainage of the structure. So I've got examples of all 3 of those questions here. So firstly, nice easy one, an identify the structure question. So question 1 is identify the stomach. So we just have a look and we see, the end of the label line coming from C is pointing to the stomach. So the answer to question 1 is going to be C. Second question is identify the structure supplied by the inferior mesenteric artery. So here we've got a question about the neurovascular supply or drainage of a structure. So if we have a look at those structures, we'll see that most of them are foregut or midgut, and therefore, in fact, all seem to be foregut, so they're going to be supplied by the celiac trunk, except for E. And E is a hindgut structure, so that's going to be supplied by the inferior mesenteric artery. So the answer to 2 is going to be E. The third question is a functional question. Here, I'm asking you to identify the structure that contains endocrine tissue that is involved in regulating glucose levels in the blood. So we know that's going to be the pancreas, so the answer to 3 is going to be D. Okay, so as you've seen, each station has 3 questions. Those questions, the answers to them are independent, and they're independent throughout the exam as well. So if you've answered, say, A to any particular question, it doesn't stop the answer to the next question being A. In fact, it's entirely possible that the answers to all the questions could be A. It's very, very unlikely, but it's a possibility. So just because you've answered A for one question doesn't stop you answering A for the next one or any of the subsequent ones. The other thing to bear in mind is, hopefully you've seen, it's a multiple choice exam. It's a single best answer multiple choice exam. So if you're a little bit doubtful about some of the answers, and hopefully you shouldn't be, you just pick the answer which you think best answers that particular question.
Stefan, thank you. I think that's very, very helpful. That was great. Even that I had done my anatomy is probably over 2 decades ago.
Yes.
I completely understood where this is going. So thank you. That was very helpful. Now, while we've got Carly online, I know she did receive a number of questions from our students. So if you don't mind, we're going to just take this opportunity and just answer some of those frequently asked questions. Would that be okay with you, Stefan?
It'll be absolutely fine.
Okay, Carly, all yours.
Okay. So thank you for that. That was really helpful to kind of give an overview, and hopefully the students now will feel a bit more confident, I feel, in terms of going forward to the exam. One of the questions that the students asking was in regards to being a timed exam, and we said to the students that they'd be able to go in and out, but how long would you anticipate it would take students to complete this exam? How long do you think it would usually take them?
Normally you'd have 25 minutes to do this exam in a dissection room. So basically you have 1 minute per station, so approximately 20 seconds per question. So, okay, it's going to be a different circumstance. You're looking at pictures on a screen and not actual specimens, so that might affect the time it takes you to recognise things. So I would say about an hour. You know, let's double the length of time. Let's just be generous. But I don't think you really want to be spending more than an hour on this exam.
Perfect. Thanks for that. That's really helpful. And as you've reiterated, so it's a 40% pass mark for students.
Yes. So that's 30 out of 75 questions, correct.
And they'll have that whole week to do it, and they can go in and out throughout that week to answer the questions.
Yes, and then they can obviously, if they decide halfway through the week that they want to change their answer to any particular question, they can go back and do that. So unlike the spotter in the first year, where once you'd left a station, you couldn't go back to it, though during the course of the exam you could change the answer. This time you can go back, look at the question again, look at the image again, and decide whether you want to keep that answer or you want to change it to one of the other 4 possible answers that you haven't used.
Super. And some of the students were questioning in regards to revision sessions.
Yes.
Is this...
It will be going ahead. So we were originally going to have a revision session today before lockdown occurred. We are now holding revision sessions for both dental students and medical students through Zoom. But because the anatomy demonstrators are required in hospitals, they will need to contact the students to find a mutually suitable time for the revision session. So each DR group will have a slightly different time for the revision session, but it will be at some point next week.
Perfect. I think that's completely realistic because you've got a wealth of staff there that have been redeployed to kind of help with the pandemic. So
yes.
What would happen if a student couldn't match with the EBL tutor?
We can't match them up with their tutor. I think what we'll do is we'll try and find out the times of one of the other groups and get them to join them. What we don't really want to do is have too many students sort of swapping groups, because then you end up with one group with 79 students, one group with 1 student, and the other 6 groups with no students or something. You know, that's obviously a very extreme example, but we want to try and avoid that. So if there's real difficulties, we'll try and match them up with another group, but they should try and work with their demonstrator to find, and the rest of their group, to find the mutually appropriate time as far as possible, so we don't end up in that scenario.
So thank you both. It was very, very helpful. So Stefan, just coming back to you for a second. Are there any other advice or comments you would like to add before I say goodbye to both of you, please?
Yes, sorry, there's just 2 more things I'd like to mention. So firstly, just to reiterate that the exam, which I'm sure most of you are expecting, is going to be on head and neck anatomy, neuroanatomy and thoracic anatomy only. You are not going to be tested on abdominal anatomy. The reason I used an abdominal example earlier on was purely because that particular question could not possibly appear in your spotter, so I wouldn't be giving anything away by showing you that. The second point I'd like to make is just to refresh your memory of what the forms looked like on the iPad, or in this case on your computer, tablet or phone. You will see for each question 5 radio buttons, so 5 circles with A, B, C, D and E next to them. So you just pick the radio button that sort of matches the appropriate answer, and of course as soon as you pick that, it removes the answer from the other radio buttons for that question.
Stefan, could I just ask a question about students if they were unsuccessful and got less than 40%? What would be the process there?
Okay, so in previous exams, the first thing that happens is the year lead would refer those students on to me, and I would have a meeting with them to talk about their study skills and what we can do to improve their anatomy studies going forward. Obviously, this would have to be like a Zoom meeting in the current situation, but obviously that's what we would do. At this stage, it would be more that I would want to try and reassure myself that they were on target to have the appropriate anatomical knowledge to move into dental practice in the future, and also to pass their subsequent semester tests.
Got one final question in regards to if any students were unsuccessful or unable to sit their exams in this first sitting, what would be the potential options for those candidates?
Okay, so as we know, students have to pass this at 40%, and therefore there will be an opportunity to sit the exam at a later date. That is likely to be very early September, so just before welcome week. And considering the current situation, it's very likely that would be an online spotter of the same format as the one they're going to sit in May. I would also like to speak to those students through a Zoom meeting beforehand, just to sort of find out a little more as to why they need to do the resit and put them in the appropriate direction to improve their anatomical knowledge before they sit that exam in September.
Okay, that's perfect. I think that clarifies a lot of the questions which the students had, and I personally got a much better vision of where we're heading with this. So could I thank both of you for giving up your time and coming to this interview. So enjoy the rest of your day, and I'll catch up with you later.
Bye.
Okay, bye-bye. Now, next I'm going to leave you with Anya to give you a 15-minute alignment toning exercise. You make sure you are absolutely in shape, not only for your exams, but also physically. Anya, they're all yours. Right, we come to the end of this episode of Manchester Molars. However, before I go, I'd like to leave you in the very capable hands of George, our BDS students, to tickle your ears with his absolutely amazing piano playing. George, they're all yours. And until next Thursday, I've been Reza Rutsari. You've been amazing. I'll see you later.